Welcome to Calling All Voices, brought to you by Dementia Action Alliance and the Global Council on Alzheimer's Disease. My name is Deborah Tan, and I serve as a board member for Dementia Action Alliance. In the Calling All Voices podcast series, you will hear from people living with dementia and care partners from diverse communities. They will share their stories about resilience and persistence and how it can help people to continue to live meaningful lives, even with a diagnosis of dementia. And you will also hear these participants discuss why it is important that we call all voices to share their experiences.
Hi, my name is Paula Mueller, and I'm the founder of CareLink 360. In this series of podcasts, I'm participating as a volunteer because I wanted that the communities hear the voices of the Latino community. I was born in Chile, but I'm living in the US for a long time. But as you can see, my roots are very much close to my family in Chile, and I'm connected to all Latin America and all the Latino communities in the US. So welcome to this podcast, Calling All Voices, Perspective from the Latino Community. 2 years ago, I spoke with Karen Love at the Dementia Action Alliance conference because I was very excited of seeing the announcement for the podcast and publication for Perspective, Calling All Voices, Perspective from the Black and also Perspective from the LGBTQ plus community. And I thought we need to also hear the voices from the Latino community. And Karen very kindly accepted the proposal, and we got this project going, from which you will hear a few of the interviews that I did. I'm very happy to present you this project because it's very important that also among the Latino community, we speak about dementia. Many times we consider that this is something that we shouldn't speak about. There is a lot of stigma around the word dementia. And the people at the end, people experiencing the dementia, and also their family caregivers, their care partners, feel that they are very much alone, and this is something that is only happening to them, but it's not. Now you're going to hear my conversation with Ana Castaneda. She's the elderly program manager at the United Community Center in Milwaukee, Wisconsin. I wanted to interview Ana because she is managing a wonderful program in Wisconsin. It's one of the few, if not the only one, memory clinic for the Latino community. And it's so important, the work that she's doing with the community, supporting them, but also teaching children about the disease. And you will hear all the programs that she has and her experiences managing the center and helping the community through the work that they do there. So listen, I hope you enjoy. Thank you. Good morning, and I'm so happy to have you again with us. And let's get started. You have big news to share with us, but please tell us about yourself, what you do, introduce your center, and then we get it started with that.
Yes, thank you so much for having me. It's really nice talking to you again, Paula. Again, my name is Ana Castaneda. I'm the Elderly Programs Manager at the United Community Center in Milwaukee. I oversee the operations for our elderly programs, and that includes our senior center. We have the largest meal site in Milwaukee County. We serve over 120 seniors on a daily basis that come for lunch and social recreational activities. I also oversee the adult daycare program, which is daycare for adults, that we also have, social recreational activities as well as a level of care for them. We specialize in people with dementia and Alzheimer's, especially Latinos, but we're able to provide any care for people with disabilities that would like to join our center. We also have some senior living apartments that we oversee, and the main thing that we will be talking about today, our memory clinic, we are the only Hispanic memory clinic in the state of Wisconsin that can do diagnose in Spanish.
Yeah, I mean that's what got me so excited, and I wanted to share your experience because it's so remarkable and so needed. This Latino memory care unit that you have, and you are serving so many. So I mean, and you are the only one in Wisconsin, correct?
Yes.
And it's a model to the rest of the country.
Yes, absolutely. So, the Latino population, we're 1 times more likely to develop Alzheimer's dementia than our white counterparts. So, making awareness, educating our population, and getting those resources available to the people, and also expanding services to other counties. That's kind of what our mission is. I've been here for 2.5 years, but, hit the ground running, and just a lot to do. And, we're blessed to have great partners here in Wisconsin that help us, and, we're able to keep going with the clinic, and the numbers, and every day we're getting calls and people needing services, so very busy, but thankful for what we have here.
No, I mean it's so important, the memory clinic, because through this journey of me interviewing the Latino community, I realized that many, I would say the vast majority of the Latinos diagnosed with dementia, any type of dementia, they are diagnosed too late.
Yes.
There is no awareness, and like we like it. So bringing awareness and early diagnosis is so important, and
Yes.
because
Absolutely.
that's the realization
We
that
see that every day, the misinformation, miseducation. So we have to start with that, to get to that community, you have to start by the education piece, which is for people to understand what's happening to their loved one. It's not a normal part of aging, it's a disease, and the disease, they need to understand what's happening to them, to not only care for their loved ones, but also for themselves. So we also offer, caregiving education classes for people to know how to manage, their own needs while caring for somebody, because it is a burden, especially in the Latino community. You see multi-family homes, where, the professional kids are taking care of their parents, but they also have kids that go to school. So it becomes, a big weight on their shoulders to have to care for somebody with dementia and Alzheimer's, and not being able to leave them at home by themselves. So that's why having the correct services in place is so important for this community.
Yeah, and you share with me sometime the people that the family caregivers, it's not easy for them just to take time off from the job. So
Right.
having those extra resources is because they may lose their job if they don't show up, right?
Yes, absolutely. And also, the cost, because, here in the United States, the cost to have somebody in a skilled nursing facility or an assisted living is the prices are not everybody's able to afford that. So having programs like an adult daycare for Latinos where they can speak their language and they can do activities. So just by keeping active and not sitting at home, just providing a better quality of life for their loved ones, it makes a huge difference.
Oh, huge. I mean, the social aspect is so relevant in their own culture, sharing their own meals, likes, dislikes, and talking about.
Meeting new people, learning new skills, especially, we're seeing more and more, at least here in Milwaukee, people from, before it was more Mexican and Puerto Ricans, and now we're seeing people from South America, Central America. And it is because, the second generation, the kids, the professionals are bringing their parents to live with them because they're not going back to their countries to care for them. So they bring them to the US, but now they're here and they're just home. They don't speak the language. So it's like they're losing what they know is their life. So it's a hard way to adapt for them to come to another country and not know the language. And, what do I do? And that's why we're seeing that sitting at home is just so hard for them. So that's why it's so important to have these social programs for them to be able to still feel independent, and still feel like they can do things on a daily basis.
You bring up a very interesting point, Anna, in terms of the migration waves, right? So how this has evolved, and in the last probably, I don't know, 20 years, it has been different waves of Latinos that have migrated to the US. Like you said, it's not so clear-cut Mexican American or Cuban American or Puerto Rican, but now we have Venezuelan, Colombian, Nicaraguan, Honduras from all over. And they come young, they adapt, but now they have aging parents back in their countries, and they are not going back, like you said, and bringing them, but they are outrooted from their countries because they don't know the language, they don't know how the system works. So it's a big change at an older age. So having the resources from the center is really a welcoming place that it is that transition. It doesn't make it completely simple because they are still missing probably some of their family members or friends, but at least it's a smoothing and a more welcoming environment.
Yes, absolutely.
That is so wonderful. And tell me more about you are so special that your services have been in high demand, and you are trying to use technology in order to reach our communities farther apart from your center, like the telehealth program that you were just telling me before.
Yes, absolutely. So, during COVID, challenging times, obviously the needs for services didn't stop. So we had to get creative on how to be able to provide our services for those people that needed them while we couldn't be face to face. So we were able to get some grants that allowed us to try a pilot for telehealth services. And what does give us was the opportunity to go wherever there's no limit to that service. So with that being the case, we tried it first here in Milwaukee. And then the idea came of, there's needs in other counties here in Wisconsin that need services that they don't have what we have here at UCC in Milwaukee. So we were able to create a Dementia Regional Consortium with 4 other counties. And that gave us the opportunity to connect with the Age and Disability Resource Center for those counties and create this partnership that allows us for, Latinos that have the care needs to come to, their aging and disability resource centers and connect with their dementia specialists. And then if they didn't have the service in Spanish, they will connect with us, and we will do at least the screening and the diagnosis, because we are just a diagnosis clinic. We will do that part for them. But from there, they could be, connected with the resources if they got a diagnosis of dementia or Alzheimer's. So we're still working on this model. It's a lot of work and a lot of progress, but we're working with our partners on all counties to even learn how to do proper outreach for Latinos. Because if you have an event, and you're going to have a health fair, for example, and you want to invite the whole community, but you're not in an area where there is primarily Latinos, you probably won't have anybody show up. So even the language that you use, the flyers, how do you, where you promote it, everything, we're trying to explain step by step how we are able to be successful, and from them to learn from us. And then that way they also are creating that trust that's so important for the Latino community. Because if they just call this number, and the first thing that you hear is somebody that answers in English, and they're not able to get through, what they need, they might not even pursue that anymore. So we're working on that, and giving us, with the telehealth is so nice, because we've been able to help people not even from out of the country, Puerto Rico, Mexico. I believe that we had, the kids live here in Milwaukee, and then their parents are in Mexico, but they're coming with them. So I think that we had already done a few telehealth assessments virtually for people even out of Wisconsin.
Oh, wow, that's wonderful. And you're absolutely right that any services, including providing education, it's so important to build the trust of the community. And that is especially true in the Latino community, but also in the African American, in the Asian American community. Everyone has to have to feel at home, at ease.
That cultural piece, welcoming, where you can connect, that similarities of, it's like, okay, they can, I can feel related to this program because they are, do you feel connected to that? It's really important. Like I said, that trust, that feeling of belonging is important.
Yeah, and as you said, it really involves all the steps, starting with the language, like you said. I mean, even if you have a flyer that is in Spanish, but then someone answered in English, it just break. It has to be all the steps along the way has to be welcoming. It's not something done ad hoc. Is something that is planned and fine-tuned, like you have been doing with your center, like your center has been doing for many years. You started 2.5 years ago, but the center is much older than that, correct?
Yes, the United Community Center has been in Milwaukee for 53 years, serving the community. They started with a small, kind of like hangout for after school programming. And then, now UCC serves all the way from 6 weeks all the way to 106. We have schools, we have drug and rehabilitation programs, we have the elderly programs, youth programs. So there's a lot of variety of services focusing on the Latino community here in Milwaukee.
Yes, that's amazing. That is so refreshing to hear, because really, as you said before, is the Latino community is affected in many aspects.
And that's why, here at the Senior Center, for example, we try to have, educational sessions where, people from the community will come and give talks about the importance of, eating healthy, exercising, how to care properly for diabetes, have, the services that they need in one stop. So if they need to see the podiatrist, if they need to get a flu shot, a COVID vaccine, have those services here at the center. So they don't have to go, elsewhere. They can just come to the center and say, oh, wow, this is so nice. I had what I needed here today. So that's our mission.
That's wonderful. And last time we also spoke about the so all type of immigrants and sometimes temporal workers that come, and then non-documented immigrants that also come to your center. Is that I mean, the services that are offering to everyone?
Yes, and that is, a huge gap that there is, and is unfair. Obviously there's a lot of Latinos that come to this country and do a lot of the work that, people that are from here wouldn't do for the price that they get paid. And they still pay taxes, but yet they don't have a right for health resources, for example. So if an immigrant comes in that is undocumented, they don't have access to Medicaid. They're not able to enroll into our long-term care program, so they wouldn't qualify, for example, to be able to come to an adult daycare or come to assisted living. They wouldn't qualify. They will have to private pay, which, like we just mentioned before, it's a really high price that they're just not able to do. In many cases, we had experienced that they are referred back to their consulate, like Mexican consulate or whatever, and all they do is ship them back to their country. Well, they're not going to get the services that they need to be cared for, the diagnosis that they have, which is really extremely sad. There are some programs that allow some grants for respite, but they're far in between, and obviously the demand is gonna to increase with more baby boomers coming, of age and developing the disease. So it's concerning, it's concerning and a little bit unfair. So we're trying to work creatively and see how we could find some funding to, whether grants or sponsorships, some organization that's willing to help the Latinos that are unable to qualify for Medicaid, because, they do need the services.
I mean, dementia is not sparing anyone. It's affecting all of us, and you're absolutely right. I mean, not giving them an option it doesn't seem to be a human fair response, right?
Right, not at all. And I think I had mentioned to you, Paula, too, that, the few occasions that we hear about, they wait so long to be diagnosed, and they get to a point where the patients might be becoming aggressive, and they're no longer to be safe at home. There's so many cracks and so much missing from that piece of level of care that's needed right now.
Thank you for bringing that up, because that is important to emphasize the need of support of everyone, because the diagnosis is not done properly. It just gets so advanced. The person is not safe to stay at home, but it's also not safe for their care partners, because they may become aggressive, agitated, and they don't have the medications that will help them manage that agitation. They don't have the professional care. They ended up in the hospital, like you said, and then the hospital doesn't know how to handle that, because the hospital is supposed to be a very temporary, short period of time. It's not an ongoing. So that is a very huge hole in the system, not to be able to care for those patients. And many, it may be that many of them ended up on the street.
And then they're putting the rest of the population at risk. It's a snowball effect. It's just continue to get worse, because first is one person, then the numbers will continue to increase. And what's going to happen to all those people? Wisconsin winters are not a safe place for people to be living in the streets. So it's concerning.
Yeah, that is absolutely right. Something else that we spoke about last time is all about the trauma that they may bring because of the experiences through their life, their hard work, and that is presented in different manifestations during the disease time. You brought that to my attention last time that we spoke.
Yeah, absolutely. I think that, people that are here, immigrants that come and, even if they live here for a short period of time, and then, they go back to their first years in life when, it was so hard for them, what they went through, the work in the fields, how they brought up their family, even the challenges to come into this country. So it's really hard, even for kids to understand, because sometimes they don't even have an idea, maybe that their parents lived, some abuse or some trauma in their life. And once they develop the disease and they find they don't understand their behavior, it's again that education piece of, is the cycle of life. And then you have to be extremely patient. There's no point of repeating yourself or getting yourself angry or worked up, because they don't realize what's happening to them. And us as caregivers have to have that empathy and just be super lovely and love just be there for them, because it could happen to us. It's not everybody has that, and I know it's really hard because it's frustrating, especially if you have a lot of stress, but being able to understand what's happening to them and just learning ways to redirect, or if they don't want to do something that you need them to do, just give them a few minutes and then go back and try in a little bit or a different way. But it is challenging for the caregivers. It's certainly challenging.
It is, and you brought an important point, that many children don't know what was the parents never speak about it, right? Never.
They're pretty private. There are things that they were not shared during, their life. So now you find out and it's like, okay, why didn't I know that? But it's something that they carry on their own. And now you're starting to see it because of the disease.
Right, absolutely. I wanted to talk about the children program that you have also, that also was very, you educate children, because as we were talking, many people living with dementia lives in the multigenerational household. So you also have a program to educate children on what does it mean that grandma or grandpa are living with dementia.
Yes, absolutely. It's a youth caregiver education, we call it. We offer it twice a year. We have one here in November. Here it's hosted at UCC for Milwaukee. And then we are starting to have one for the other counties as well that we're working with for other people.
Oh, great.
But what we do is we have our neurologist, and then we have our social worker and nurse just talk with the kids, explain what dementia is, in a kid's language, so it's easy for them to understand. The neurologist also brings samples of brain so they can see a healthy brain and a brain with Alzheimer's, so they can see the difference. And they also go through the virtual dementia training, which is for them to learn, like you said, what's happening to their grandpa or grandma, because they think, oh, my grandma, she repeats things 10 times. And it's not that, you know, it's like she doesn't comprehend, or she doesn't remember that she just told you that. So we will put, you know, like the goggles that are scraped so they can see their vision changes that they experience. And we'll put like spikes in their shoes so they can feel, you know, the feeling that they have when they're walking, like people with dementia and Alzheimer's, you know, their vision changes, you know, how you approach them. If you come here, they see blurry, that's why they startle and get scared, because they can clearly see you. Or you're trying to give them directions, you know, so they have headphones with noise, and you ask them to do a few tasks, but they're not able to comprehend you because there's too much going on in the noise. So, you know, it's interesting to see the kids' reaction, because they do get frustrated. You know, they have gloves, so he's like, okay, count 5 pills, and they're not able to grab them because they have these gloves that are, you know, are not easy to manage. So once we have the dementia training and then we have the debrief with them, it's really humbling to hear what the kids express, you know, because you can see their faces. At first, they think that this is a game, you know, and when they're done with the exercise, they are, you know, touched by it. Like, you know, like they have seen their grandma or grandpa go through things like this, not being able to buckle their, you know, their belts, and not being able to put their button-up shirt. So the kids really bring up, you know, to listen to their experience is really humbling. Like I said, it's just great to hear, and for them to understand, you know, and then be able to share, you know. Maybe there's 3 kids in a home and only 1 came. I'm sure that that kid will go and talk to the brother and sister and say, hey, this is what I learned today. You have no idea, you know, what this feels like. You know, I was really frustrated that I couldn't do such a simple thing, but you know, that's maybe what's happening to grandma, you know. And that's how, you know, word of mouth and education, and it's just really important for the kids at a young age to understand, because yeah, sometimes, you know, their parents are at work and they are the ones left at the home with their grandpa or grandma.
Right. And then they are going to share that at the school as well. Yeah, no, it's all about education, and as early as we can start raising awareness, and it gives them another perspective on what's grandma or grandpa are experiencing right now. Like you said that very well. Many times mom or dad has, or both of them has to go to work,
Right.
and the only option is that the girl or the boy stay at home with grandpa or grandma, and it can be challenging because it's challenging for us. So how what else can we expect for the little children, right? That's wonderful. And so what are the projects for 2024 for the center?
Well, just continue to grow. You know, we are, like I had explained, you know, because our programs are so well formed, you know, we are getting a lot of people coming to the daycare center, you know, we're working on that, but also growing the memory clinic, you know, finding more resources. We just hosted this past weekend. So we had a huge event where we had 14 different resources come for people, you know, to just stop by and just learn about dementia and Alzheimer's and the resources available to them. You know, whether it's the county, whether it's a pharmacy, a local pharmacy where they can speak Spanish, you know. So we were offering flu shots for them here, COVID vaccines. And then we did a little presentation for them to understand dementia. And it was just great. We had over 50 people that came. It was the first time we ever did it. So it was, you know, just continue to find ways to, you know, get to more people, be able to offer more resources, growing, you know, continue to work with these counties and these partnerships that we have so that more people can be reached. So that's our goal, you know, just continue to make awareness and given, you know, helping others to be able to do, you know, the job that is needed.
How do people find about you? I mean, the family caregivers, how are they finding about the center? Because so I imagine most of the time the family members are the one that brings their loved ones for the memory clinic.
Yes, so we try to, obviously advertise internally with the UCC schools. We also try to send information to the parents. Having these events is really helpful as well. So we do, the social media outreach, and then just try to be out in the community as much as possible. We participate in the Alzheimer's Walk. I was able to participate in a summit or a presentation that was done for Waukesha County, which, it was really nice for me to be able to be a part of this event, because I was able to share what we do here in Milwaukee. But it was at the same time, frustrating, because the people were asking me, like, why don't we have this in our counties? We need these services. And it's, long term, it's like, we're doing the right thing. We're having these events, we're speaking up what the needs are in the community. So we need to continue to do that, but also, find short-term solutions. And, I suggested, for example, that right now we don't have transportation that goes between counties, but these are the services that are so crucial that, maybe if the county is right next to Milwaukee and they just need services, there should be a bus that comes across county lines and be able to provide services for people. So I think focusing more, I know that, of course, money is a big part of, the limitations we have for resources, but, kind of getting creative in how to help people that need the services.
Right, right. From where do you get the fundings right now? I mean, you said grants, but also the Office of Aging is helping you.
Yeah, we have some grants from the county, but that's mostly for the senior center, and mostly for the senior center programming. And then for the memory clinic, we have partnerships with UW-Madison. So the Wisconsin Partnership Program. They are the ones that help us the most with the memory clinic. And then we work, again, just fund development here at UCC, trying to look for funding for us to be able to, continue to grow our programs.
It's wonderful. And in terms of the medical professionals, do you have challenges finding the right professionals that can speak Spanish as well?
It is a bit challenging, yes. I think that we had found some, we'll start from our neurologist. So our neurologist is actually Italian, but he speaks Spanish. So we have no problem there, it's a great connection. But yes, because we're only diagnosis, once they go back to their primaries, most of them will be English speaking doctors. But, there's 16th Street clinics here in Milwaukee that are mostly Hispanic also. So we have a good relationship with them. And we're just working with hospitals, they come to us, obviously, we do a lot of research for different universities and different hospital networks, because we do have a lot of Latinos that come here to UCC. So we kind of work together, join forces and help each other as much as we can.
Absolutely, absolutely. I mean, that is, I mentioned that because I experienced in the support groups that I've been facilitated, in more than one occasion, the family care partner had told me, my mom speaks English well, but she really, because of the disease at this type of the diagnosis, she feels much more comfortable talking with someone in Spanish. It's somehow the English, she feels insecure that she's not understanding properly what the other person is telling, what the physician or the medical doctor is telling her. In Spanish, she's a little bit more at ease. Is that your experience as well?
Yeah, and it's, I know that there is a lot of resources for translators, but even that, again, because of the culture and that trust, I think that having a third person there translating, it kind of breaks a little bit of that relationship that you should have with your doctor, especially when you're dealing with, such a hard diagnosis and any medical condition, it's just hard to have a third person, and, you're looking at the doctor, and that the whole interaction I have witnessed multiple times with some of my clients here at UCC, and it's just like they want me to translate because they trust me more than a translator perhaps that will show up for them.
Right. That is true. I mean, it's not necessarily they don't trust. It's a matter of trust, and you are absolutely
they
right.
don't know the person, So it's like, how do I really know that what they're telling me is what the doctor's telling me? That kind of makes them question, but they don't understand. So yeah, that's another layer that
Another layer, absolutely. No, it's so important. All the details that you are sharing with us, and it's everything. It's everything in order to achieve the goal of providing a better life, or the good life that everyone deserves.
Yes, yes,
Under this condition or any other condition. I really applaud your center and your efforts and your advocacy, and that you are sharing with us these wonderful programs that you have, all encompassing in Milwaukee. Really, I wanted to shine the light on your program and share that information with the rest of the world, as many people as we can reach through this podcast, because centers like yours have to be multiply many
absolutely,
times.
absolutely. It would be nice to have one in each community,
Yeah,
there's for people to have options. Absolutely.
absolutely. Tell me, Ana, if you want to share something else for someone starting a center or trying to do an initiative like yours, is there anything that you would like to share?
Well, just, look for the resources available. Every community has them, even if, they might not be fast, but there is resources available for people. So just, if you know somebody that has a care need or see somebody that's struggling, helping each other. I think that, we have technology, which is a great resource that, 34 years ago did not exist. Right now, we can just go on our phones. If you know somebody, just help them, help them find the help that they need, and be that advocate for those that are not able to help themselves. I think it's so important. And like I said, I am blessed to have the job that I have and be able to be a part of this organization that, impacts so many people's life. And I think that there's no price, there's nothing better than that to be able. And that's why, when you reach out to me, it's just such a great opportunity for, like you said, we need to keep speaking up and share those experiences and what we're learning. And, not just the good, but also the difficult, like the lack and the gaps that we have, so that we
Yeah.
can improve and change that. So that's a fight that, the more that we fight, the more that we're gonna conquer. So I'm really, really happy and thankful for this opportunity.
No, thank you, Ana, so much for all what you do, and for all what you have shared with us. It's so remarkable. Thank you so very much.
Thank you, Paula.
We hope that you enjoyed this episode of Calling All Voices. If you're interested in learning more, please visit Dementia Action Alliance and or the Global Council on Alzheimer's Disease websites for resources and information on Calling All Voices. The creation of this podcast was sponsored by Otsuka Pharmaceutical Development and Commercialization Incorporated. This podcast is not, however, intended to provide medical advice. The views, thoughts, and opinions represented herein solely belong to the individuals sharing their experiences and do not represent the views, thoughts, and opinions of Otsuka Pharmaceutical Development and Commercialization Incorporated or its affiliates. If you have specific questions, medical questions that is, by all means, contact your healthcare provider. If you enjoyed what you heard today, please make sure to subscribe to this series and share a review and let others know what you heard and or experienced on today. I'm Dr. Tan, and bye for now.